but that was what they wanted us to believe, that there's no way that you could get COVID if you had the vaccination.
Welcome back to Making It Awkward, an independent podcast by folks who love meeting new colleagues and having interesting conversations. This is your host, dietitian Jessica Wilson, and author of It's Always Been Ours. You can find me on Instagram at jessicawilson.msrd, and you can email the pod at makingitawkwardpod@gmail.com. To support this show, you can rate it, review it, join the Patreon, and follow us for more. You can also watch video of this interview on YouTube and Spotify, something that I highly recommend for this episode. If you write an Apple Podcast review or comment on YouTube or Spotify, I can bring my dad back to the show to read them. Today, my guest is psychiatrist Dr. Carole Lieberman, or Dr. Carole, known nationwide as the terrorist therapist. Dr. Carole is a board-certified forensic psychiatrist, best-selling author, and 3-time Emmy-honored TV personality. Dr. Carole specializes in the psychology of terrorism, criminal behavior, and political breakdown. She's a frequent guest on Fox News, Newsmax, OAN, and other leading patriot platforms. Her bold insights expose how psychological tactics once used by foreign enemies are now being weaponized against the American people. Dr. Carole is also an expert in Trump derangement syndrome, calling out how elite figures like James Comey and even now deceased Pope Francis display signs of irrational Trump obsession. Dr. Carole connects the dots between radical indoctrination, media-fueled hysteria, and how psychological warfare is now being deployed inside the U.S., not just abroad. She also provides insight into the minds of killers, from incel-fueled killers like Brian Kohlberger to emerging serial predator cases. Dr. Carole breaks down the psychological red flags the media misses, explaining how cultural shifts, digital radicalization, and mass psychosis are feeding modern American crime. She also breaks down how unchecked psychological decline is weakening patriotism, eroding resilience, and leaving America vulnerable. While I was incredibly impressed with the breadth and depth of Dr. Carole's expertise, these topics didn't quite fit with what we'd been examining on the podcast, and she was happy to talk with me about RFK and the Maha Report instead. With that, I'm so excited to bring you my interview with Dr. Carole. Dr. Carole, welcome to the show.
Thank you. Pleasure to be here.
I'm so excited to bring you on specifically to talk about RFK Jr. And you said already that you'd be open to talking about the Maha reports. I am so grateful for your time right now. When it comes to RFK, do you mind if we take a step back, say, to COVID and mask mandates and vaccine mandates? And I feel like his name started coming around and coming up a lot more. Then, are you able to speak to that time period?
Yes, he was one of the sane ones during COVID, one of the few sane ones.
Yeah.
COVID has, not really COVID, but the lockdowns, all of these rules, have really destroyed a lot of America. I have not taken the vaccine. I wouldn't let my daughter take the vaccine. I didn't want anybody putting strange things into my body. Unfortunately, a lot of people didn't have that luxury to say no, because if they were going to be fired, for example.
Correct.
And then of course the masks, we learned that they really don't do anything. It kind of doesn't make sense that, if everybody's supposed to be getting vaccinated, then why would we need masks? Like, who's going to be having COVID if they're all vaccinated, right?
Right.
Well, not true, but that was what they wanted us to believe, that there's no way that you could get COVID if you had the vaccination.
Yeah.
Of course, now it's so sad to see how many people are suffering from side effects of this vaccine, heart ailments and Guillain-Barré and just all kinds of things. I mean, people dropping dead. I'm sure you've been paying attention to this. Young people dropping dead, like all out of the blue. And then of course it turns out that they took the vaccine. It's just, and then a Fauci. I can't wait for Fauci to be imprisoned. I mean, I don't know why it's taking so long, but I am looking forward to it. He was really a snake in the grass. He knew, that he could take advantage of people. He made a lot of money on this. He started the whole thing by financing China's research and so we financed it, through taxes.
Sure.
And all of that. And he, how he refuses still to say that he did anything wrong. Mm-hmm. And so he has to be locked up. Now, I actually knew Fauci years ago.
Okay.
Yes. I was, when there was a cable channel on, very well known, very watched, about medicine. It was Lifetime medical television. And I worked on it. I was on camera. I was a producer. I was a writer. I did a lot of things. And one of the things that I would do would be to get the guests. So like we would decide what topics we were going to talk about. And then some people would suggest who would be the best guests. And so whenever it was something having to do with infection, infectious disease, respiration, things like that, they would say, "Oh, got to get Fauci." And I would call up. He was at the NIH at the time. I guess he's always been. And I would get him on the phone and I would convince him. I would ask him, would he like to be on such and such a show at such and such a time? And he always said yes.
Sure.
And so the people at this station thought I was like a genius for getting Fauci to keep saying yes. Now, I was not a genius. As it turns out, Fauci is just a media
you can say it. You can say the word.
A media whore. Yes. And he would have come on anything that I was asking him or anybody else asked him to do. But it made me look good. So that was my first connection to Fauci. And now, unfortunately, since it was such a new condition, Trump didn't have anybody who was telling him the other side of it. So he believed Fauci for a while anyway, but then he got smart and realized that this was, not true. But I mean, nobody really knew, so it wasn't like people were able to counter. Plus Fauci had this position, for years. And so one would tend to believe him, and not think that he was a snake in the grass. But
I'm with you. Yeah.
But, now we know the letters, the text, the emails, have been revealed, his correspondence with various people that show that he knew all along that what he was saying was a lie. So, and a lot of people died from his bad advice.
No, I totally hear what you're saying. Was the COVID vaccine the first vaccine for you and your family that you were like the most cautious about? Was it from, the COVID times, or had your family been kind of skeptical?
Well, I have never taken, neither has anyone in my family, flu shots. I don't take flu shots every year because I don't believe in putting, who knows what into my body. My mother actually, she had a bad reaction to flu shots. She got it once or twice, and so she didn't take it again. But she lived to 101 and a half. Nice. So I figure if she did that without taking all these vaccines, that's the way to go.
Fair. I get that. So you, like many people, were very attuned to wanting, body autonomy at that time. I worked at a workplace. I was required not only to get the vaccine, but we were required to get testing done on a regular basis. So I definitely understand the impacts. Of those mandates. But
I can see testing. Especially if it's something to do with patients or, necessarily just every office, but like it was something where other people were going to be affected, like as a nurse or something like that, or, then I could see getting tested, but that's different from taking a vaccine.
Okay. No, I appreciate that. So a lot of mistrust with the Fauci mandates and vaccine mandates, and just like the general, it seemed, mistrust and distrust that grew from that.
Yes.
Yeah. Did you become more aware of what you were putting in your body, what you were eating or anything like that during those times in RFK?
I actually did a media campaign.
Okay.
Telling people I had a heal myself, where each letter stood for something. Wow. And I was doing a whole campaign about getting people to do these things every day instead of taking the vaccine. I mean, I didn't say, at the beginning, don't take it. because I didn't want to be responsible for anyone getting COVID. I said I wasn't taking it. My daughter wasn't taking it. I said, there are things you can do to build your immune system other than taking the vaccine. And I heal myself. So, there was laughter, there was music, every letter stood for some different thing. And I had a website, pleasefirefauci.com.
Nice. Yeah.
And on this website, I had this campaign, these things that you should do instead. I was trying to say, I didn't tell people at the beginning, don't take it. Then gradually I did start saying that. And I all the time said, don't give it to your children, because I knew that would be dangerous. How did I know that? Because not only did they not do enough testing on adults before they rolled it out, but they certainly couldn't have done testing on children enough to know what would happen 10 years from the time that the child took the vaccine. Sure. So there was no way people should take it.
So with that acronym, like, did you find folks coming to you and wanting, more information, or, what kind of things were they telling you with how impactful your program was?
Well, I mean, I got, these weren't like specifically patients of mine. This was like when I would be doing interviews on television, on radio. I was spreading like a media campaign. I was spreading this all around. So I didn't necessarily get direct feedback, although, some people, when I connected back with them, said, that they had been doing this and they hadn't gotten sick yet, that kind of thing. Heal myself. I can tell you what it was. H is healthy, nutritious food. E is exercise, walks in the sun or dancing in your living room. A is aromatherapy, candles or flowers around your home. L is laughter, 1 hour a day. M, so that's heal. Then myself. M is meditation or calming music. Y is your choice of vitamins and supplements. S is sleep 8 hours a night. E, engage with friends and family to support each other. L, limit your daily intake of gloom and doom. And F, follow your passion.
That's phenomenal. I love that so much. I could not, when you said how long it was, I said, there's no way that there will be, that you will find a good way, to wrap all of these things up. And that was fantastic. Oh, I love that.
It's easy to remember, it's, not just hearing it once necessarily, but that's why I had it on my website. And, some people will remember, well, I guess depending upon what, whether you were listening to a podcast where you could replay it, or a television show, you could replay it, or something like that. But that is really, definitely helps your immune system and isn't dangerous. None of that is dangerous for you.
I love it. That definitely seems like a lot of what the so-called at the time and on TikTok, like trad wives, traditional wives, like the really return to, our roots and the things that we, valued once upon a time. So I definitely see that connection there.
Yes. Yeah. I started to talk about some of these things. I hadn't put it into an acronym, or I hadn't put it together like that until COVID came. But before that, there were fires in Malibu, and I would be helping people try to stay healthy, and not let the stress get to them. And so I would talk about some of these things, and then I put it together for COVID.
Wow. So you were ahead of that game.
Yes, unfortunately.
I know, right? Malibu is, yeah. So what have you seen from RFK, or actually, are you comfortable saying if you were an early RFK Jr. supporter for president?
Oh, for president?
For president.
I did not support him. I was a Trumper all the way.
Okay. Thank you. And then how did you feel when he came on to Trump's campaign?
I thought that was good. Okay. I thought it was good for both of them. I think it helped both of them.
I agree 100%.
He RFK Jr. would not have won the presidency. So at least this way, he's able to do what he does best, really, which is helping people with health. That's really where his heart is, not necessarily being president, but if he were president, he would have been able to put it into action. But now he can just work on that and not have to worry about taxes and all kinds of other problems that presidents have.
Yeah, fair. Yeah, the Make America Healthy Again became an official commission. So yeah. What do you think about Make America Healthy Again?
I think it's great.
Yeah.
I have joined their movement as as a physician.
Okay.
And I mean, as a psychiatrist,
Mm-hmm.
I was never asked, it was never a matter as a psychiatrist, I wouldn't be giving the vaccines to begin with,
Sure.
so people wouldn't be coming to me for physical help.
Uh-huh.
But I mean, other than how your mind, your brain affects your physical body as well. So I am all for making some of these changes and long overdue.
Right.
This should have been done. I mean, some of the things that we have been subjected to, like, for example, the fake food, chemical food,
Okay.
and just all processed food in general. I mean, some are worse than others, but chemical food in general has really affected us for however long we're alive here. And I mean, it's gotten worse and worse over the years. And some of the things like, I agree with not letting money that is supposed to go to like food stamps, that shouldn't be spent on candy and soda, things that make people develop diabetes that then taxpayers have to pay for in terms of the treatment. That does not make any sense. We're paying for people to have food, okay, but not to have food that's going to get them sick, that then we're going to have to pay for their treatment. I know that the left really is very angry about any suggestion that he would do things like that. But, why can't we spend our money on whatever kind of food we want?
I mean, yeah, right. I mean, does that kind of go along with conservative values of like not constricting choices and the choices that we're making, or no?
Well, no, I'm saying the people who were opposed to limiting what the food stamps or EBT or whatever it's called, different things, what that goes to. Some people believe that there should be total free choice, that they're poor if they want to have a candy bar to make them happy. I mean, I'm a chocoholic, so I can certainly
relate.
Yes, I can relate to that. But that's not really true. And besides, so what? We should allow people to make themselves sick. I mean, yes, we should be free in a way that you can argue we should be free to make our own choices. Everybody should be free. But then not if you have other people paying for it.
Okay. That's it. Okay. I'm with you. You mentioned the MAHA reports before we got started, and I'm so excited to hear any thoughts that you've had on either the initial or the follow-up strategy report, if there's anything that stuck out to you as far as things you're glad that's in, or maybe stuff that you wish had been in but was out.
Right. Well, one thing I'm glad it's in is the idea of limiting drug companies from advertising without any restrictions.
Yeah.
Because, without putting all the side effects. It used to be that they had to put all the side effects. Of course, then do you remember that used to be a long thing at the bottom? They'd say it really, really quickly. You couldn't really hear them or see it, but at least it was there, and maybe, now we should have it better, more legible and all that. But yes, because I've had people coming to me and saying, I think I should be on such and such because they saw it in an ad on television, and people seemed happy when they were taking that pill, or, and then you have to explain, no, that is not a good pill for you because you have this condition, or because there are these side effects, or so and then sometimes they'll go to another psychiatrist who will give them that pill, even though it will hurt them. So I think those conversations, I mean, I don't know that the advertisements should be blocked altogether, but there definitely should be the potential side effects. So people don't just assume that this will make their lives better and they'll make them happy. And, some medication does. But of course, that's another thing, that there's something in what MAHA wants to do in regard to all the kids who are on ADHD medication. And I totally agree with that because, nowadays, if you have a child, a 5-year-old, or any age, really giving it to any age, a child who maybe is restless or has problems in school or is running around the classroom. Now, sure, those can be signs of ADHD or ADD, but they aren't necessarily. And you need to take there are tests, psychological tests to give kids to see whether they really do have ADHD. Maybe they are restless because someone is abusing them at home. Or maybe because their parents are getting divorced, or maybe, they're being bullied at school. There are 100 reasons why they could be acting that way that have nothing to do with ADHD or ADD. So, and when you start someone on this medication, there are studies now that show that there can be bad effects in the future. Like when they get to be an adolescent, they are more likely to get hooked on drugs, particularly uppers, of course. And, so that's not good. And also what's not good is not giving them therapy. Anytime you throw a pill at somebody, and this is he hasn't addressed this, but I'm hoping that he will, or I'm suggesting these things. That the big problem, there are two main problems in psychiatry.
Okay.
One is that we closed the state mental hospitals.
All right.
And threw all the patients out, with the saying being that we are giving them the least restrictive environment. So it was supposed to be a good thing. But in fact, with people who were in the state mental hospitals, most of them had schizophrenia or manic depressive illness, bipolar disorder, or addiction, chronic addiction, things where they did need to be in the hospital for a very long time. You can't solve these things overnight. And in fact, schizophrenia, you can't cure, or bipolar, you can't cure, but you can treat them and control the symptoms. But you also need to give them insight into their disorder. And so, because you can't just let them out into society and hope. The idea was that they would go to clinics, that there would be these community clinics that then these patients were supposed to go to. Well, once they ran out of their meds, assuming that they kept taking it every day to begin with, which was not really likely, but because in the hospital they are given the meds every day,
Right. Yeah.
So even if they took their meds, when they ran out, the idea that they would be able to find their way to a community clinic, and there weren't enough community clinics built at that time anyway, and there still aren't enough. That was a ridiculous, anybody who knew anything about these things. I trained it. I was the chief resident, in fact, at NYU Bellevue. And there you got to see everything, not only schizophrenia and bipolar and really every kind of mental illness. It was an amazing place to learn psychiatry. So anybody who knew anything like that, could have told the president. It was Reagan. I love Reagan. Everybody loves Reagan. Well, not everybody, but he was a great president, but he got wrong advice.
All right.
He was getting the wrong advice.
Okay.
So it was doomed from the get-go, but it was like the ACLU, who you said, oh yes, patients do need to have the least restrictive environment, et cetera, but they didn't know what they were talking about. Yes, on paper, that would be very nice, but with the disease, the disorder, the mental illness, you can't really have that kind of situation because most of these people don't have families who will take them, if there were enough clinics, to the clinic every week or every month. And this is the second part of the problem in psychiatry. The second part is that psychiatrists have sort of surrendered to insurance companies. They have some years ago, it's been a while already. It's just gotten worse, but where the insurance companies decided that they don't have to pay, or which it would cost them less money to pay psychiatrists to do therapy, to do talk therapy, 45 minutes to an hour of talk therapy. and psychiatrists. So they started paying that it would be cheaper to pay psychologists, social workers, marriage and family therapists. And so that's what they set up the payment schedule so that these other people who didn't go to medical school would get less money, but they'd be okay with it. Whereas psychiatrists couldn't support themselves because if you see someone for like 45 minutes or an hour, that's 8 patients a day. And at the rates that insurance companies were paying, you couldn't support yourself. So, psychiatrists have surrendered, most psychiatrists, not me. I won't see a patient unless they see me at least once a week for therapy.
Mm-hmm.
And if they need medicine, yes, of course I give them whatever, not all patients need medicine, but if they do, then yes, I give them the proper medicine.
Mm-hmm.
But along with the psychotherapy, because any pill, regardless of what it is, it does not cure whatever the problem is. An antidepressant, let's say.
Mm-hmm.
Sure, some antidepressants help and you have to figure out which antidepressants for which patient and all that kind of stuff.
Mm-hmm.
But they do help to control the symptoms while they then are in psychotherapy. They can pay attention to psychotherapy. But same thing with any mental illness. And so, but that is not what's happening these days. And so people those who even go to a psychiatrist are just getting prescriptions thrown at them.
Got it.
They see them for like a half an hour to 45 minutes the first time around. Mm-hmm. Then they give them a prescription. They send them on their way. And then the person they tell them to come back in a month or 3 months or 6 months. It varies. And then when the person comes back, they're not better for the most part. And so then they throw another prescription at them. And this is why we have people today, many people, on 5 and 6 different kinds of medications, a sleeping pill, all different kinds of medications. Because even when you give someone medication, you need to be seeing them every week. You need to see what the medication is doing. Are they having side effects? Is it not working well enough? Do you need to increase the dose? You have to see them very frequently in order to make the most of the medication. And plus, of course, as I was saying, you need to be giving them talk therapy because that's the only thing that gets to the root of their problem.
Okay. This is helpful. This is great. And the money just wasn't in psychiatry, it seems. So seeing like 3 or 4 people an hour was going to be the only place to make money versus like an hour of talk therapy where you would get paid for that entire hour. Is that what I'm hearing?
Yes.
Okay.
Of course, there are ways of tackling that. Like if there was more money given to clinics, so that they could pay like there are individual psychiatrists who would be billing individual insurance companies, but then also there are clinics, of course, they bill insurance companies. I mean, any way you slice it, they need to recognize one, that patients need more time in a hospital to get better.
Okay.
Some patients, certain patients.
Sure.
And 2, everybody, with the people getting crazier and crazier these days, everybody needs talk therapy.
This is helpful. It makes me think of the MAHA strategy report. It mentioned a variety of options for helping with mental health, and one of them was the foster care system. And it wasn't clear in the report, but RFK has mentioned something to the effect of sending kids and adolescents to like wellness farms where they would, be out in nature and eating organic food. And from your expertise, well, one, I was wondering if that had been something that you'd heard, but also, do you think that would be a good thing?
I hadn't heard of it, but I do think it would be a good thing. I'm not sure.
It's tricky.
Of course you do need mental health professionals.
Oh, yes. It was unclear. It sounded like kids might be taken out of their living situation to go, live somewhere else and, have these wellness experiences. But I'm curious about whether or not like a wellness farm you think would be a good intervention, or there might be some concerns with it.
Yes, I do think it could be good as long as you have real professionals.
Okay.
But yes, especially kids who are in environments like when you were saying foster family, like there's a lot of problems with foster families, a lot of times there's abuse and all that. So I think it would be good to take them out of some of these foster families and put them on a foster farm. I mean, yes, all children could benefit from being in that kind of an environment. It's kind of like a camp,
Yeah. Yeah.
I went to camp since I was 7 years old, and I always used to get homesick, but it built character.
Mm-hmm.
Because, you have to sleep. I'm talking about sleepaway camps.
Totally. Yeah.
It built character, it wasn't always easy, but you learned how to deal with that. And at that time it was like 8 weeks, a summer camp was 8 weeks.
Yeah.
And so you learned how to be without your parents for 8 weeks. I started with a Girl Scout camp when I was 7 years old. That was a little cruel and unusual punishment. But yeah, it did help. I mean, I think it really, it did make me stronger.
Yeah, it adds that structure, rigidity, that community, the things to do outdoors. And do you, as a psychiatrist, see if there would be any drawbacks, say, from taking a kiddo with mental health challenges or somebody who's been told they have ADHD out of their home environment and then bringing them back into that same environment? Or do you think it would be an easy transition?
Well, I do think that there would need to be some kind of a detransitioning, reorientation to your messed up family. That's where family education and family therapy. I mean, in a perfect world, when they came back, they would have family therapy for several sessions. And, to get the whole family to think the same way about buying healthier food and that kind of thing.
Yeah. If you have time, I'd love to ask you one psychiatry question. If you have to go, I fully understand. Okay.
How can I leave you in the middle?
Okay. I heard a lot more psychiatrists in the pandemic start talking about like ketogenic diets for curing or supporting mental health, a lot of supplements. That was one of the things you had in your acronym. And I was wondering where, you saw the field going as far as supplements and ketogenic diets, and if you've used any of those in your practice.
A ketogenic diet is like mainly for losing weight. Mm-hmm. And you have to be, it works. Well, it depends on, it works for some people.
Some people not,
can have, side effects. Like, if you have too many ketones in your body, it can be dangerous. Yeah. When I said that's why I had it with the Y, your choice of supplements, vitamins and supplements. I didn't want to tell people specific ones. I mean, I took during COVID things that help your immune system, immune boosters. I did recommend that. The Z-Pack. I live by the Z-Pack. Don't listen to me. Don't try this at home. Yes. But in my experience, when I have, and knock wood, I haven't had to do it in quite a while, but when I would, even before COVID, when I would feel that I was getting a cold or a flu or something, I would go to the drugstore and get a Z-Pack, zithromycin. Yeah. And it does, somebody told me about it. And so I tried it. And for me, it works. You also can't do it too often because it loses its effectiveness if every, couple of months you're taking that. You can't just take it for a little cold.
Yeah. So that's one thing. For sure. Do patients ask you about like probiotics for their microbiome and mental health?
Yes, I can't say that I really get into that. I became a psychiatrist. Well, when I was a little girl, 8 years old, I read a book about the first woman physician in America, who was Elizabeth Blackwell. And I decided I wanted to be a doctor. Okay, much to my parents' consternation, who thought I should be a teacher. But anyhow, they have vacations and all these good things, right? And I think maybe they thought it would be which it is, a grueling career. But in any case, so then when I was a teenager, I read Freud's interpretation of dreams, and I totally connected to it. And I realized that the kind of doctor I wanted to be was a psychiatrist. And strange stories, when I did before doing a residency in psychiatry, I did an internship in straight medicine. And I did that at the New York Infirmary. And when I went into the hospital for the first time, I think it was to have an interview, there was a statue in the lobby, a huge statue of Elizabeth Blackwell. It's like the Twilight Zone. Then when I was a resident, I talked the department head of psychiatry, incredible man, into letting me take off like 3 or 4 months to go to London to study under Anna Freud. And this was right before she died, and she was still sharp as a tack. And that was like an incredible experience. So I mentioned that because my way of approaching patients is a very psychoanalytically oriented way.
I'm with you.
So, not any of this, these sort of shortcuts where you do these, there's different kinds of therapy that are basically supposed to be shortcuts, like short-term therapy, like you do 10 sessions and you know what I'm talking about? And I don't do that. And so I have a psychoanalytically oriented view of people. In other words, to get back to their childhood, talk about the traumas of their childhood. And the thing is, I've been doing this for a long time, and people come in with all different kinds of problems, relationship problems, work problems, all different kinds of things. And it always turns out that whatever the problem is that they're having currently has to do with something from their childhood.
Yeah.
And so that's why, talk therapy, particularly psychoanalytically oriented talk therapy, is something that is really gets to the root of it and really makes the difference. You don't have to take pills for 5 million years.
Right. So no, this is super helpful. So you can't, like, what you're saying is so very important, but you couldn't, supplement yourself out of your childhood trauma. You couldn't ketogenic diet yourself out of these things. Right. Which is super helpful. I do see these, take whatever in order to improve your mental health, and like soon you won't need, therapy or whatever.
I mean, I'm not against certain supplements.
No, sure.
But that is not the cure-all.
Right. That's not the easy fix. This is a long-term investment in mental health. It's not just gonna go away tomorrow.
Right.
Yeah. No, this is great. I'm so glad that I got to ask you about that. I really appreciate that, because a lot, on TikTok and Instagram, it'll just be, this easy short-term intervention. So yeah, this is great.
It's so tempting because we all want to be fixed right away, and we don't want to go through the pain of remembering our traumas of childhood. I mean, who wants to dwell on that? But it is amazing what a breakthrough it is,
Yeah. It's rough. Those layers, hard to pull off, but very important. Yeah. Thank you so much for your time, Dr. Carole. This has been wonderful.
Well, it was my pleasure.
Thanks so much to Dr. Carole for coming on the show. I was so compelled by the points that she made in this interview that I'll be having a follow-up episode to explore her ideas more. As I get thoughts and feedback ready for that episode, next week I'll re-release my episode with Blake Flahar about RFK and additional topics. I think it's a fitting bridge from the episode with Dr. Carole to the follow-up. If you have any thoughts, ideas, or want to send me a voice memo with your feedback about this episode, you can email them to makingitawkwardpod@gmail.com. And with that, friends, have a conversation with a new colleague and let it be awkward. This podcast is a production of me, Jessica Wilson, and The Body Politic. It is edited and mixed by Jen Jacobs, a fellow patriot. You can support the podcast by joining the Patreon, rating, reviewing, subscribing, sharing it with a friend, watching it on YouTube. Thanks for listening. It's supported by the Legacy of Sacramento Outboard Services. Can't wait to see you back.